Ready? It is now 1:30, time to convene the Montezuma County Board of Health. With
Okay.
that, we'll turn it over to Bobby.
All right, thank you. So welcome everyone to this is our third quarter meeting, held a little bit early, simply because of a conflict of dates for Laurel and I. So we moved it to September 24th instead of next week. So let's just go around the table and do introductions. Bobby Locke, the Director of Montezuma County Public Health.
I'm Laurel Schaefer, Assistant Director.
I'm Katie Maxwell, Public Health Planner.
Amanda Mullen, County Medical Officer.
Asha Atwell, I'm the Director of the Hasin Street Medicine Program.
Kent Lindsay, Montezuma County Commissioner.
Ian McLaren, Montezuma County Attorney.
Company for Montezuma County Commissioner.
Okay, thank you. Approval of the July minutes. Everybody read them? Any changes, issues, questions? No? Okay. All right, thank you. And so they've been approved. So today we are fortunate enough, we literally just went and got a hold of Dr. Atwell, and she's here now, right from Hasin Street Medicine, over at the Episcopal Church at the moment. So we have her with us today to kind of talk about what street medicine does, am I saying it right, Hasin? No?
Hasin.
Hasin, see?
It means hope in Navajo.
Nice. Okay. So the Hasin serves many communities, and obviously Dr. Atwell can fill us in on exactly who she serves, what she does, and how we can work with her in public health. So.
Thanks for having me. I really appreciate it. So I have been coming into Cortez since September of 2022. And before that, we started in October 5th of 2021 in Shiprock doing street medicine. And then before that, so after Shiprock, we started moving into Farmington and then to Cortez. So it's been this progression, trying to cover people who are experiencing homelessness throughout the region. And the reason why we're doing that is because it came to our attention during the pandemic that a lot of people were not being served and were not being able to be cared for. So I was the emergency medicine director in Shiprock at the time of the pandemic. And so at that time, I talked to our community health director, who's Dr. Percy, and I had told him we have a lot of people on the street that aren't being accounted for in any of our public planning, and nobody is really thinking about what we're going to do for them when they get sick. Folks that are going to have COVID out, at wherever in the common places where people go, we were worried about them spreading illness and not being well themselves. So we came up with plans for that. And, my position came out of that time. So I got really, really burnt out on emergency medicine. And Dr. Percy said, hey, you want to develop a program to address healthcare delivery for people experiencing homelessness. And so I developed this program from the ground up. And what I did was I went around and talked to different folks that do street medicine all over the country. And actually, this is a worldwide movement at this point. And what it is different in every place. But what I tried to do was pull different parts from different programs and bring them to first Shiprock, like I said, then Farmington, then Cortez. Of course, it looks very different here because we're not so urban, so it has to really conform to the place you're in. It has to conform to the needs of the patients you're serving. So in Shiprock, things look different than they do in Farmington, and they look different than they do in Cortez. So what we do is we come into each area and we partner with different community entities. So we really try to work within the community rather than coming in and imposing something on a place. So when I first came to Cortez, I made, tried to make a meeting where I got to get together with everybody. Unfortunately, you guys weren't there. But it was hospital folks from Southwest Memorial. Amanda actually was there. Bobby, I think you were there, and so was Laurel. And then I talked to fire and EMS and all these different representatives from the different people that we would be, kind of interacting with on the daily. And then I asked, I said, this is what we're going to be doing. We're going to be coming in on a Tuesday afternoon. We're going to be looking for people out on the street and then just asking if they need anything health-wise and seeing what we can do for them. And at that point, they all just kind of said, great, sounds good. So that's what kind of started everything here. We partner with the Indigenous Wellbriety Group, who runs talking circles. They're really great. So they offer some peer support for folks because each of them have their own lived experience with addiction and being on the street. And they've gone through rehab and they've gone through the system. And so now they're able to provide support for others that are on the street. We work with the court. So, Beth Padilla has the outreach court, and she came and presented to our to the Montezuma County Coalition to End Homelessness. And so we work with her as well. And when we're driving around on a Tuesday, we also have a representative from Access Health. I have Amanda's number on my cell phone so that if I need her help getting a patient plugged in for services, then I can tap her and ask her for help. One of our limitations is that I work for Indian Health Service, so I have to, I can easily plug in someone into the Indian Health Service system, but it is more difficult for me to plug somebody in when they are non-native. So one of my challenges this whole time is anything that I'm doing, I want to be able to provide equally across the board to everybody. I don't want to provide one service to one person and then tell the next person, sorry, I can't do that for you. So what I do instead is see everybody who comes and try to make sure that whatever their needs are that they express are met. So the whole clinic runs on expressed need. So this is not exactly a primary care clinic, and it's also not an ER, and it's also not, an acute care, but I kind of function as all of those things. So, a couple of weeks ago, there was a gentleman that was passed out, and he had overdosed on an opiate, and I was the first person there, so I was able to jaw thrust for him. We got Narcan in him right away. And then we called EMS, and they were able to respond. But during that time, I was able to get all of that done and get his finger stick checked and make sure that, all of the basic bases were covered before EMS even arrived. So that's one example, but then there's others. We also treat people for alcohol use disorder out on the street. So there are medications that can help people decrease their cravings over time. So we do that. We also help with so many things. There's a rapid test right now for HIV and syphilis. We do that a lot because syphilis is rampant in our communities. We know that New Mexico is number 2 in the nation for syphilis. Arizona is number 1. Congenital syphilis is number 1 in New Mexico. So all of these things are very close to our door, and it's really important that we are addressing them from a public health standpoint. So what we do is we have this rapid test. If somebody comes back positive for syphilis, we treat them right then and there. And then we plug them in so that we continue to treat them as time goes on. So if somebody needs more than one shot of penicillin, then we're able to provide that. I've been working with Bobby on this actually because if we have somebody who's non-native, we need to draw labs for that person. That's standard of care. And so I can't process those labs. So it's been sort of this, what do we do with these labs? How do we make sure this is accessible to everybody? And so I've worked with Bobby on that, and also Amanda a ton. So what we right now currently do is I hand them to Southwest Memorial Lab, and then I've called the STI coordinator from Grand Junction, and then she's able to contact trace and pay attention to the results and so forth. So there's been a lot of work done on my part to try to coordinate some of the care in this county as far as STIs and treatment. But, we can always improve on that. And so those are some of the needs that we have is just good coordination, making sure people are getting served equally. And I think that's really important. We also, we give out food every single clinic because people are experiencing a lot of food insecurity here, and I'm sure you guys are aware of that. We found somebody a few weeks ago, this was actually 1st of July, around that time. A gentleman in the park who said, "It must be Tuesday because I haven't eaten since the last time I saw you." And we brought food for him, and he downed these. We had these big pots of stew, and he took 4 of those and ate them one after another right in front of us. That gentleman actually passed away in the bushes like later that week. These are just really, preventable things. So another thing we've talked about working on together is preventable deaths in the county, and just kind of being aware of some of those things that we can work on together. Yeah, so that's kind of mostly what street medicine does. We go around and we try to provide all those services for folks. Some people express to us that they would really like a primary care doctor, and they'd like to get back on their blood pressure medicines and things, normal things that you would do if you went to a doctor. So we do that. We check their blood pressure, and we're able to prescribe, medicine for them. If this person is a beneficiary, we also are able to give their medicines from our IHS pharmacy to them on the street. And so that's a service that we do. So we deliver those medicines later in the week for those folks. And then if it's a non-beneficiary, somebody who is not an IHS patient, then I call that into Walmart or Walgreens or whatever their preference is. So medicines are a big thing we do. Another big thing is patients who have serious mental illness and who are on the street. They require antipsychotic medicine, and there have been a few that we've been able to get on a long-acting injectable medicine, which is great because they don't have to take it. It's just in their system. So every person that we've started on that regimen so far has become housed, except for one, and that person lives in Farmington. So it is a very successful mode of treatment, because a lot of times the mental illness is what's keeping a person from being able to be housed. And there's one guy in particular is a great example. So he ended up getting on a long-acting injectable. He now holds a stable job, and he is able to see his daughter again, and he's housed. So he's a productive member of society here in Montezuma County, which is really a cool transition to see. So these are kind of some of the things we're working on. And I, of course, forgot to mention Pinion Project is a big part of what we do. So they also are part of our team. They come with us every single time that we go around. They offer a lot of case management. They've also helped get people placed into rehab and sober living facilities. And then when they come back, that's actually one of the things we need to work on is what happens to that person once they land back in our county, because right now there's not a lot of support for that person for aftercare. So a lot of the times we've noticed people come back and then they are back to drinking almost immediately, because there's nowhere for them to transition to go to aftercare to continue to be housed, and that's a rough transition. So that's something that I'm working with Pinion Project on. So I'm pretty active in the community. I hope that came across in what I've been talking about. And I hope that I get to be more active and talk with more of you and find out what the other needs are.
Oh, that's a lot, obviously, that you heard that goes on with street medicine. Do you have questions for Dr. Atwell about what they do and how they go about doing it?
How many, when you're talking about treating, how many of them are you treating a day? In a day's time, just an average, just
Usually between 30 and 40 each clinic. And then similar to that down in Shiprock and in Farmington, it's somewhere between 70 and 100 per clinic day. Yeah, and so I actually, to date, I have just under 3,000 patients that are being served by our program.
So, and maybe you said this, and forgive me if you did, the places where you locate yourself. So, Episcopal Church.
Yeah, thanks. I didn't talk about this, but what we did was when we came here, we kind of thought about, so I actually went on a ride along with Lucia. And I lived in Cortez also, so it wasn't like, totally mind-blowing about where to find folks, because I lived here. I moved to Dolores since, so I'm in the county. But I went with Lucia Bueno Valdez, who was an active member at Pinion Project for a long time. She took me around and we looked at different sites of where people tend to congregate and where people shelter, like encampments and things like that. And based on the entire premise of street medicine is to bring medicine to the people. So the idea is you bring it to them and that helps lift them up. So what we're trying to do is make things accessible for folks. So initially we went to the soup kitchen line at Grace's Kitchen. And so we still do that. So we meet right at lunchtime. We see everybody who is sort of either waiting around for us, or at first people didn't know us, so we would just stand near the line and say, hey, we're here, this is what we're doing, we can help out with whatever you need. And then before you know it, we have people that are, actively coming every week to see us. So that's our first stop. And after that, we drive around onto Montezuma Boulevard, and then we go next to Montezuma Park, kind of cruise that whole thing, go to City Market and that backside where people wait for the bus over there. Often there are people waiting for us over there. So we check in with them, we see how they're doing. Sometimes we go through the alley that goes next to, kind of perpendicular to City Market, because a lot of folks will hang out in that alley, and we make sure they're safe and they're not passed out in the corner and, something is wrong. And then we go to the park. So often we'll go around the library and around Veterans Park. Veterans Park is probably a big, heavy-hitting spot for us. And then, so all of this we try to do and finish going and cruising around town by 3, because that's usually when we're at Pinion Project at the day center. So the majority of folks that we see, kind of the big bulk of people we see is either at the soup kitchen or at Pinion Project, and then in between there we're just picking up whoever we can. Sometimes, so in the wintertime, people use the lobby for the recreation center as a warming spot. So we'll go and stop in there and just check in with staff and see if there's anybody that's around. And then the McDonald's is another spot where people go to try to get warm. So we'll go in there and just look around and see if anybody's around. We also go into the library, and we've had a good relationship with the librarians. They'll let us know if there's somebody they've seen outside or they're worried about somebody. So we'll, cruise around the library just quietly looking and see if there's anybody. They've been really great. So a lot of community members are really, really supportive of the program and happy that they have somebody that they can talk to and ask for help with different things. So that's sort of the structure.
Right. So what would you say would be the key things that you see for Montezuma County and the population you serve? What are like the top 3 things that you think are the biggest issue that you encounter?
So I do a ton of alcohol use disorder management, and I would say that's throughout the entire region, not just Montezuma County. So, people struggle with addiction, and that's one of the biggest things. So what we do is we engage them on that. We try to figure out where they're at in their addiction and figure out where they're thinking. If somebody is not ready yet, not willing to talk about it, that's one thing. But usually if you show up every week and you keep talking about it, at some point they're like, yeah, you're right. And so we offer Vivitrol or naltrexone, and so that's either the oral version or the shot. So the shot is 4 weeks of, alcohol cessation help. And that is, some people, it's been a real game changer for them. The number needed to treat for that is like 19. So you have to treat 19 folks before you see somebody that's like really benefiting from it. And those people that are really benefiting, which is great. So you can, kind of tailor your treatment toward that. There's also some of these folks, the reason they drink is because of a sense of loss or grief. And I see that a lot, that seems to be something that keeps people on the street. So if you address their mental health. So we do have a therapist that's with us every time that we're out on our rounds. I was mentioning this to these guys when they were walking me over. Our team is structured by myself, another physician, so Dr. Percy most of the time, but sometimes it's somebody else. We have some students and residents that come with us, and then we also have a public health nurse and a therapist. And the therapist does acu-detox, which are little pressure points around the ears, just to help with alcohol cessation, some of the symptoms that come up. And that has been super well received. So we do that. We do some on-the-spot therapy, and then we've been able to also schedule appointments for folks that want to continue with therapy, so that they have an ongoing relationship with our therapist. Some of our folks we plug into Access and get mental health help that way, but it just depends on what they need. And some people prefer a more structured environment versus coming and seeing us, and so we try to respect that as well. But alcohol use disorder is probably the top, and then all of the issues kind of surrounding that. So there's a lot of interpersonal violence and wounds that I see. So I do a ton of wound care out there. And boy, I mean, I see broken bones a ton, and people who don't want to go to the hospital for that. And so we talk them into it most of the time. And if I can't talk them into it, there have been some people that we, splint them in place, or we, sometimes there's radial fractures, like distal radius fractures you can do with a hematoma block. You can put their fracture back into place. So I've done that before. It just depends on, I try to push real hard to get them to the hospital. So it just depends on that person. But there are things that can be done for them on the street. And, my background as an emergency physician lends itself well to this environment. So it is a nice practice environment for me. So those are kind of the top things I see.
Okay.
Yeah. We are distributing a ton of Narcan, by the way. There are a fair amount of people who need needle exchange. And we also are providing condoms if that's a needed thing. Like I said, STIs are a big deal for our practice, and so sexually transmitted infections are something that we are always kind of in our head, like we need to be thinking about this, we need to be working on this. So that's a huge part of what we do, and making sure they have the antibiotics for that. So we do carry a formulary, which is in a suitcase, and I'm able to give people medicine right on the spot. So there's no delay. So that's a big deal, because a lot of the times when they're discharged from the hospital, they have a prescription, but it's at the pharmacy, and they don't have the funds to go get that medicine. So when I show up and I have it for them, it really cuts that out.
Right.
It makes treatment a lot more successful.
Right. And in the moment, at that point in time, they're receptive to care, they're receptive to that.
Yep.
So that's the best case scenario.
Yeah. Also, one more thing about the broken bones. I have an ultrasound that I use to help diagnose fractures. So I'm able to just look at the bone, see where things are broken, and then that actually helps inform what kind of treatment they need. So it's just another tool that we have in our bag.
Yeah. I'm very grateful that you're here, and I know a lot of other people in the community are too, for sure. So we had talked about, the reason, Dr. Atwell, we invited her here is because we want to support this work. This is serving the public. So we have had conversations with the state, and what she was referring to is what we're going to try to do with the state, and we have to have more conversation, but we're hopefully going to be able to send test results to the state lab using the courier, and it would be at no cost. It's for those who are not able to receive care through the street medicine vehicle. So that's what we're working on. There will be limits to it as to how many we can do in the course of a year, but the state has that availability, and it's basically like a little contract that we would go into an agreement with the state that we'd have, say 15 HIV tests a year or 5 syphilis tests a year, whatever the quota is that they give us, then that's how we'll be able to structure this. So,
Can I just add?
Absolutely.
So when I spoke with the state entity, she asked me for a ballpark figure
Right.
as to how many non-beneficiaries I'm seeing. So it's about 8% of the population here of people experiencing homelessness, 8 to 10, somewhere in there. So it's really not that many, to be honest. It's per clinic, like you're talking a handful.
Right.
And then out of that, I'm maybe getting a positive HIV or syphilis once every 6 months or
Okay.
every 4 months or something like that. And so those are the ones that I really need to make sure get those tests and that treatment. And we want to make sure that that's equal across the board.
Right.
So,
And-
yeah,
and-
it's not that many, but
Right.
it's important to do.
But even just one, even
Yeah.
if we were to help one, that reduces the chance of spread
Yeah.
to others. So, you
Yep.
know, and when you treat one, you need to treat the partner, right? Otherwise,
Yeah.
it just keeps going back and forth. So,
Yes.
and
so-
oftentimes they're not both Native Americans.
Correct.
So.
Correct. Yeah, syphilis cannot differentiate.
Right. Exactly.
Yeah. So yeah, that's one of the things. And you know, we had talked initially about this because we had a person that was non-native that was partnered with a native person. And we were concerned about syphilis in that couple. So if we do have that scenario, we treat both of them. And like I said, we draw labs. So ideally, what will happen then is both of them get their labs drawn, both of them get treated, and then I hand off the person that's a non-native person to Amanda and Jay, and they help me with that. And then I call your STI coordinator from Grand Junction. So that's kind of what's been happening. But getting those tests done through the public health department will just make it even better care and easier for the public health department to trace that in the future. That's what she was talking about with me too. Yeah.
Right. Yeah, no, I think it's definitely a good way to just give best care and ultimately prevent the spread of STIs in Montezuma County. That's what it's all about. So, any other questions for Dr. Atwell?
Are you seeing any new kinds of diseases showing up?
We have the Mpox vaccine actually that we're able to give if we are concerned about that. I'm actually going to get it myself just because I'm around people all the time, and I feel like I'm in close quarters. Why not? You know. But yeah, that vaccine is available to us, and it is something that we've been able to give on street medicine. So, and we also do give COVID vaccines and flu vaccines, and then we update tetanus shots as well when we see a wound that needs that. So, so those are some of the things we do. And Mpox we haven't seen in our area, but I don't know if you guys heard there was a case really recently in the last couple weeks in Ganado. So it's around, and we gotta be cautious.
And just, I'm kind of jumping ahead a little bit to the communicable conversation, but our third quarter this year, we actually had as far as reportable cases, reportable that we got for syphilis was just 1 in the last quarter, but chlamydia was 12. So it's definitely, and 3 gonorrhea cases. That's just in the third quarter so far this year for our county.
Yeah, so that we have the ability during our street rounds, we actually pop up a tent, and we have the ability for a person to use that because there are so few bathrooms in Montezuma County that are public for people to use. So it's really important to be able to collect that specimen to be able to look for those infections. So I think access is one of the issues and why you're not seeing quite as many as I bet there are.
Right. Yeah. I mean, this is always just as representative with any disease process, right? You know, I mean, COVID it brings all that back. You know, there's way more COVID cases than there were reported, right? So it's just the nature of the beast. So, but the work you do is fantastic, and we see a lot of the folks come into our department. We know when you're out there. We have a lot more traffic in our lobby. So, but that's great. I mean, that's what it's all about. So, do you guys have any questions, Dr. Atwell? Okay.
Is the turnaround time at your lab okay?
I mean, I'm an ER doc, so right now would be nice. So no, I mean, I guess what I could say is most of the time we have the information for the patient by the next clinic, which I think is really important so that it's still fresh in their minds. And then we're able to say, oh, you know, yep, that test came back. It did show that you have trichomonas or whatever. And then we can treat them right away. But with the syphilis, like I was saying, we know right away. because we have that rapid test. Yeah. And so the turnaround on that is wonderful because we can tell them right now. It also makes them aware that, I had an exposure I didn't realize I had, or something like that. And then what we can do is talk them into the urine sample and further testing, because then they know, if one's here, maybe another one. So that's been a really good thing.
And my final ask is personal safety. You comfortable out there with your group?
Yeah. I've spent a long time trying to gain trust and make sure that, we are well received. So one of the big things that's been great is our patients are so kind to us. If there is a scuffle going on in one corner, I have had patients immediately step in front of me to protect me. So I don't really have that sense of fear. Like even as an ER doc, I'd been punched and kicked in the head and spit at and all kinds of things, but I don't feel that danger when I'm out on the street. And some of that is just because we're also reading the situation constantly, so we don't go up on somewhere that seems to be already agitated. If we notice people are, cussing at us or upset, we just leave. There's not a need for us to force ourselves on people. So we're careful about that.
Okay. Well, I know Dr. Atwell's services are being requested probably right now as we speak. So we really appreciate you coming, and we'll continue to have our communications, and hopefully we will be able to get this instituted by January 1 for the state lab. So that's our goal. So
Everybody for having me.
thanks. Okay, so I just realized you walked over here with us. How far are you going?
I don't know. I'll call them and find out where I'm going.
Okay.
Maybe my car's over there, so.
Over at, okay. So, all right. Because I just realized you came over here, but we don't know where you're headed. No, it's not. It's not. Okay. Thanks again, Asha. Okay. All right. Okay, so we're going to move on to basically the health department update, but we'll start with, so Katie Maxwell, you're up, and you can talk about our community health survey, which, by the way, Dr. Atwell has been sharing that on her mobile unit to get folks to do the survey as well, which has been great. So,
Yes, thank you. So I'm going to give you an update on our community health survey, and I did put a flyer in front of you. Hopefully you've seen them around. But this survey is part of our community health assessment, and this is something we do every 5 years. As of 2008, it's actually required by state statute that we do this in order to meet the changing needs of our community. So this survey opened in August, and it will be closing at the end of October. We're having it open for 3 months, and this is our best chance to get the community voice feedback on what people are experiencing. The survey takes about 5 minutes to fill out, and it covers a variety of topics. They all fall under the social determinants of health. So it's everything from mental health experiences to accessing healthcare, to accessing food and housing. There's a lot in there. But we did try to keep it as short as we could with addressing all that. And the last time we did this survey was pre-COVID, and 2017, 2018, I think. And the biggest focus area that came out of that was mental health. So based off of that information, we were able to do some things in the health department, including bringing in our suicide prevention program, which is where I started, and now I'm in a different position. But that's some of the things that we can do with this information, is be able to bring in programming to serve the needs that we're seeing based on what people are saying. So it's really exciting. Right now we have 493 responses, which is great. I do keep hearing that we had 800 last time, so I'm trying to get us there. We'll keep pushing it. But 493 is really great, actually, and when I talk to other counties that are rural in the community, a lot of them average about 300. So this is still really great, and it just shows that our community is very invested in supporting itself and supporting one another. I think the only other thing I'll mention is we're doing pretty well getting kind of like a lot of different populations within our community. We could do better getting men to take it. So any men listening, that's that was a pretty big hint there. 68% female response rate, which is down from like 78%. So we're getting there. Did the veterans stand down this weekend, and that helped. But yeah, doing pretty well getting those results, but we really do need to hear from all sectors of our community to make sure we're able to serve them. And I will be sharing probably a brief summary of the information once we get it, later at the end of this year, maybe beginning of next year. And then the next step is using this information to guide our 5-year strategic planning process. And that is not just the health department. That is a community-wide process, and we have many community partners that will be involved in helping us meet those goals. Currently, our goal from last time with mental health, we are working with multiple community organizations to meet those goals from last time as well. So while it is the health department, it's a community-wide picture. It's many organizations that are involved in the response to this, and also we want this information to be able to be used by the public or other organizations, because like I said, it's hard to get the community voice, and this is really our best chance. So I think that's what I have. Anything else to add?
I can't think of anything else unless you all could think of a place that you think would be a good place for us to go to get people's voice. We've hit a lot of the events around town.
Yes. Yeah, a lot of locations, a lot of events.
Even the third Thursday you did.
Yes.
So, I mean, we've hit a lot of different events. Do you have something?
I'll put them in my clinic.
That would be great.
Because I can get all of the
That'd be
providers
great.
to get
A
their
lot
patients to
of where
fill them
people are
out.
waiting is a key key place to put something like this. So, yeah. I think didn't we put?
I think there are flyers up
Yeah,
with the QR
these
code.
things with the QR code.
Oh, I should
Yeah.
mention that. So you can take a paper survey, and we have the paper surveys a bunch of places: the library, the health department, I think almost all the libraries in the county, and many other places as well. But you can also take it online using a QR code, which has been fun figuring out for everybody to use that. But yes, so there's two ways to take it.
I actually was successful doing the QR code, so that
Which is a
monumental
shocker,
because
yeah.
I don't like those things, and I did it, so it's not hard. I can vouch for that. So yeah, I mean, it really would be good. And I think the other population, we have a large quantity of women, but most of the women seem to be married too.
Yes,
so
we need more
single voices.
single
Yeah,
people in
single
general.
women.
Yeah.
Single men, Ian,
Yeah. Just spin a couple of categories there.
Anyway, yeah, we really want a varied, different voices, because that's how we're going to determine, like you said, moving forward, what we want to work on in our community. So, anyway, great. Thanks, Katie. You got any questions for Katie? Okay.
Thanks for taking the survey in advance.
Yeah.
Consistent with who follows up in my clinic to their follow-up visits, too.
Exactly.
What type of age group are you most getting your responses from?
Is that what you asked? I have it right here, but I think we're pretty well spread on that one. Yeah, we've got a pretty wide, everything from 17 and up to 80 and older. We've got pretty good in all of those age ranges. I would say the 17 and under is where we have the least. So.
I think in that respect, when we compare that to last time, 5 years ago, I think that's a better spread on ages than we had historically. So that's good. I mean.
Yeah, we've been really trying. I mean, like, trying to hit all the different cross sections and go to the senior center lunch and do different things like that. So,
Yeah. All right. Well, okay, so moving on to other things with the department. Let's see. We had, just talking funding, we had applied for 2 different grants. We applied to the Denver Foundation. I cannot remember the amount that we asked for. I blocked it out because we were denied the funding, so I can't remember the exact amount that we wrote for. But then we wrote for CDPHE through the OPHP office, applied for a grant with them. We asked for $50,000. They got a lot of applicants, apparently, throughout the state, and so we ended up getting $11,000 of the 50 that we asked for. So we are going to continue looking and continue searching for funding, as we always do. One good thing from a funding perspective is Medicaid bumped up their reimbursement rates, so our dental clinic has benefited by that, so that's been very good. It's been helpful for our dental clinic for sure. So as far as staffing goes, we continue to shift staffing around. Right now we currently have 1 position open, which is our admin assistant position / Healthy Montezuma specialist, program specialist position. So we have several applicants for that. I was looking at them before I came over here, so we're going through those applications, and then we'll set up some interviews hopefully to get that position filled soon. Let's see, what else? Can you think of anything else, Laurel, as far as departmental wise? Okay. Okay. Communicables, I'll just go real brief, and because I think the Narcan fentanyl test strips are always interesting to see the trends with that. The first quarter of the year, I'm going to give the history because I know, well, Jim's not here, but he usually likes to know where we were and where we are now. So if I go back to the first quarter, as far as the fentanyl test strips go, we gave out 75 fentanyl test strip kits. The second quarter, we gave out 90. And then this quarter, it's huge. However, we gave a big portion to a community partner. So it's 6,930, but 6,850 went to a community partner. And we gave out 80 to individuals, okay? So it's kind of, it's not, growing in leaps and bounds, but again, that was a particular organization. Now our Narcan, has grown. So initially, first quarter, we gave out 32 Narcan to the public. Then in second quarter, we gave out 133 Narcans. And this quarter, we've given out 125. So the Narcan is definitely a good tool to be used. And we are giving those out. Let's see, what else? COVID. Right now, we have 179 cases in Montezuma County of COVID. The last quarter, we only have 49. So it's getting to be that time of year. So animal bites is kind of staying. We had 15 in the last quarter. We had 13 in this quarter. But we also had 2 bats that we tested for rabies, and they both came back negative. So, and the STI, sexually transmitted infections, they have kind of, initially the first quarter of syphilis was 7 cases, then we had 2 cases, and now we're down to 1 case. But again, that's like what's reported, right? And what's treated. So chlamydia, 3 the first quarter, 6 the second quarter, and now we're up to 12. And gonorrhea is up to 3. So we do have a problem with these diseases, and they are completely preventable. And that's the key. So that's what we're trying to work on with community partners to figure out how we can get the care that the folks need. Let's see. We have not had a positive case of West Nile in our county. There have been cases in Colorado, 35 confirmed cases in humans. There's been some cases confirmed in some raptors and 4 horses also, but not in Montezuma County. Pertussis is climbing in numbers, and actually when we went to go pick up Dr. Atwell, the public health nurse that was there said that they're seeing an increase in pertussis and she was talking about New Mexico when she said that, but they're seeing it through street medicine too. So pertussis is definitely on the rise. Yeah, exactly. Yeah. What did you say? Well, while you're getting your booster, you can do your survey. So I don't necessarily have any other updates on communicables or anything else other than we can talk about our next Board of Health meeting. But before I do that, do you have any questions for me about anything?
Yeah, the rise in infectious, do you see any correlation between that and going back to school? Okay.
No, not in correlation to that, no.
It just empirically, I've seen upper respiratory infections for the first 2 weeks.
Okay.
We're going back to
Yes,
school, but nothing-
yes,
Right.
yes.
Nothing really to write home about.
And that's very typical every school year, it seems to be.
Depends on whether you have them grandkids coming along.
That's right.
Tell them to wash their hands.
Yes, it's true, it's true. Okay, so no more questions?
One for later.
One for later,
Yep.
okay. So thinking about our next Board of Health meeting, it should be on, oh, I'm sorry. Yeah, did you have a, sorry, Amanda.
I'll just give my primary care.
Yeah, go for it.
Public service
Sorry about
announcements for
that.
this
Yep.
time of year. Get your flu and COVID shots once applicable or due. Flu you can get any time now. COVID, if you're due for a booster, get it. If you're over 65, get your RSV shot. Okay, speaking of grandkids coming around. And then, yeah, Tdap boosters with the rise in pertussis. So I think those are the big public service announcements I've been giving in my clinic for people in the winter having a plan for physical activity and socialization. So spread that around. Yeah.
So, yeah.
We tend to hibernate and get a little depressed and gain some weight in the winter. So making a plan for that
That's so true.
in September instead of catching up in February.
Good points. All right. Okay. So our next Board of Health meeting is supposed to be on January 7th, which is the first Tuesday of 2025. I know. It's a good year. So I kind of, the problem with that date is I will not be working that day. So we can either still have it or we can just put it off another week and do it on January 14th.
How do we do that?
Put it off till the 14th? Okay. You don't have any big plans on Valentine's Day or, no, that's not Valentine's Day. It's January.
that's February.
That's January. It's okay. I don't want to interfere with anything. Every month, okay. All right, so January 14th then will be our next Board of Health meeting, okay? And I appreciate you being flexible with that. Does that work for you?
Yeah.
Okay.
Tuesdays, yeah,
It's good?
normal day off.
Okay. Oh. This is your day off. Okay. All right. Okay, well, I don't have anything else. If everybody's good, we can
Adios.
adjourn our meeting.
Bobby,
Oh,
last-
yes.
I was watching a deal on last night
Uh-huh.
on one of the stations. They were reporting on the Narcan and different stuff, and they were showing what all they gave out in Seattle to people.
Okay.
If you went into one of their into the county health clinic, this is all the things you could get. It's everything from the pipes, instructions how to build stuff. It was crazy.
It doesn't sound like prevention.
No, this was actually how to use the drugs and everything.
In a health.
I will comment on the pipes, though. I
Yeah,
would
go ahead.
prefer people to smoke than inject. It's much safer to smoke something than to inject something. That's
Yeah, but they were
That's
gi-
something
they were-
that I
they-
do
they
tell
were
my
giving out-
patients.
They were giving everything out.
I don't give them pipes, though.
The needles, the pipes, the instructions how to build a pipe, how to do all this stuff.
The only like how it that would prevent would be smoking safer than injecting. And if that's preventing people from injecting, then maybe.
I wonder
just-
if it
It was
was,
amazing to me, all the stuff that they had there. I mean, you wouldn't believe all the stuff that they were giving them.
so what, I just got to ask, what was it that you were watching? Was it the national news?
Yeah, it was a national news.
One of
And
the
they
main
They
stations?
just went into the clinic and asked for this stuff, and they just give it to them. They just had a bag already made up of all this stuff, and they just gave them.
I mean, there's multiple avenues for prevention and harm reduction, but I'm not familiar with anything that would be that extensive on the how-tos of it, not
No, that's not
prevention.
something that the ASAM or SAMHSA, the Addiction Medicine Societies, that's not something they've been
Yeah.
pushing for sure. I
Yeah,
know
I'm
that
not
we talk
familiar with
about the
that.
nuances of use and
Do you know what station?
How
I mean,
more
is there a
safe
way,
to
can
use.
you find that stuff? Like after it's already been viewed? Could I, like,
Oh, I'm
go
sure you
online and
could.
Google what, because I don't know what it
I
was.
was trying to remember which station it was. we were
You could
watching,
probably
but they
Google
actually-
Seattle Health Clinic. and-
yeah, that might be interesting.
I'll have to look it up
up.
because I am not
But-
familiar with that at all.
It was actually, I thought they said it was actually the county health
Okay.
clinic was doing this
Huh.
stuff, and I thought, man.
Yeah, no.
Yeah. The only thing I can think prevention-wise is safety
Well, I can
of
understand what
not
you're saying.
injecting.
That's
Right,
one
yeah,
thing.
right.
but
To have all of the
No.
stuff that they had there that they
Yeah.
were just giving out to people to
Right.
use the drugs with,
yeah.
Right.
And safe use
to me,
sites
it
are
seemed like, you know.
evidence-based, but
Yeah.
Taxpayer funded. They
Yeah.
actually said this is all taxpayer funded.
that's something we can look into.
Yeah, I'll have to do a little
We'll
digging
have
to
to
see
look
what
and
this
see it,
is,
but
yeah.
I was just amazed at all the stuff that they had in that bag that they were giving to people.
Yeah,
Yeah.
no, we don't have pipes.
It's
We don't
not
take
what we got specifically, and if,
It's like they're promoting youth.
Yeah, I don't know.
I mean,
I'll have to do some digging and try to find it.
Yeah, show that to me. I'd
Because
love to
sometimes,
see.
you know, they take, you know, and all of the media, or, no, well, I probably shouldn't say that, but they're notorious for taking clips and just showing
because
what they want you to see of their message, right?
what
So-
that place might have been is a safe use site.
Yeah,
and
I don't
some
know.
health departments will do that.
Right.
Is have a place
that's
where you can
true.
use safely.
Right.
And they will provide you with tools to use.
It could have been
safely.
something like
It
that.
might have been something like
And
that.
they made
And that
it
is
portrayed that
evidence-based
it
for,
was like the whole health department and was giving out
Yeah.
things like that, which is not, that's not what
Typical.
typically public health does. So,
but
yeah, I'll do
I-
a little research, try to
I
find
do want to
that.
comment on how much Asha is doing too. I meant to do this while she was here, but I've gone out with her twice and I haven't been able to since, but I've communicated with her almost every Tuesday for something. But she's really helped my patients with ER follow-ups afterwards. That's been a big thing that weighs on me in primary care, is getting my people who don't have transportation or a home, a place to live, in for follow-ups from severe illnesses and hospitalizations. So that's been a huge help for our community and has decreased our load at the hospital for prolonged admissions and recurrent ER visits. And she didn't get to quite comment on that. That's been something that's been a huge help and has helped the hospital a lot. And then having that support from the state will take a little bit of burden off of me as a primary care doctor that's just kind of trying to do this on the side and help with it. That will take some of that contact tracing burden off of like the two of us, basically, or the three of us. So that will be a big help. And we are getting a lot of tests back in a timely manner, not quite in an afternoon if we have to bring them to the lab and get them back to her, but from a primary care timeline standpoint, that's
pretty good.
getting someone followed up on in a week is actually, I'm pretty happy with that and pretty impressed with the care we're able to provide between all of us. So.
One of our, I call them our friends and neighbors that are frequently next door. Her hand was hurt. We've been giving her ice packs. It was, you've got to go, you should get this looked at, but she's in a brace now. She's just carrying on with her life. So she was treated and Yeah.
I want to tell one more really sweet story from this team. She didn't bring this up, but I love this. So they had a patient with an ankle fracture, and this was when Dr. Carlock was still here in podiatry. The patient had a puppy that he was taking care of and was really important to him. Someone from their team actually took care of that puppy while he was having surgery and had to be in the hospital, and then reunited him with his dog afterwards. So it really did. It built trust with that patient, and who was already very skeptical of any medical care. So, and they've done things like that for the whole time they've been doing this. So
It's a great service, and it's a great, it's a great group of people, and they clearly connect well with pretty much anyone. But they definitely trust the team. So it's amazing how much it has grown. And I think she's being asked to go to more places too. And I think I do think that it's going to get bigger than one street medicine team 1 day a week is going to be able to handle. And honestly, I personally would love to see more than just see a scene. I would love to see a street medicine for Montezuma County residents, period. So with what they're doing plus otherwise would be wonderful. Because there's a lot of people out there who do not seek care for a multitude of reasons, and ultimately it impacts every single person in Montezuma County in one way or another. So it's a huge need. So anyway, anything else? Anyone else has to say? Okay. All right.
Thank you.
Now we'll adjourn.
All right.
Thank you. I know.